All right, well, good afternoon, everybody, and thank you for joining our media briefing with the Department of Public Health. Today we have Dr. Ferrer, who will provide updates on COVID-19 and vaccination updates. We will then take your questions. If you want to be put into queue to ask a question, please click on the hand icon that's in the participant panel, and that will put you in queue. You can also send me a chat. I'm the host, and I will manually put you into queue. So with that, I will turn things over to the Director of Public Health, Dr. Barbara Ferrer.
Thank you, and good afternoon, everyone. We're glad you're here to join for today's briefing. I will be sharing an update on cases, hospitalizations, and deaths by age, race, and ethnicity. I'll also share some updated information about the Delta variant in LA County. We'll have some new figures on vaccinations by age, race, and ethnicity. And we'll also talk today a little bit about COVID-19 cases among people that have been fully vaccinated. I'll take the first slide. I'm sad to report 6 additional deaths today. All of the people who died had underlying health conditions, and this does bring the total number of deaths to 24,489 in LA County. To those who have lost friends, family, neighbors, or coworkers to the virus, please know that our thoughts and our hearts are with you during this most difficult time. We are reporting 506 new cases today, and I want to note this is the highest number of cases we've reported in a day since mid-April, and it brings the total number of cases in LA County to 1,250,717. There are 275 people currently hospitalized with COVID-19. And there are 40 open investigations at residential congregate settings and non-residential settings with at least 1 confirmed case of COVID-19. To date, more than 7 million people have been tested and had test results reported in LA County. And our daily test positivity rate is now, this number is wrong, I apologize, it's 1.2%, which is an increase from last week. Our daily average case rate is 2.9 cases per 100,000 people. This is also an increase from last week's rate of 1.74 cases per 100,000 people. We'll take the next slide. This graph shows trend lines in cases, hospitalizations, and deaths in our county from March 1st through June 23rd of this year. The slight increase in cases that I noted last week persists this week, and you'll note that the trend upward in cases beginning in early June and 2 weeks later is also accompanied now by a small uptick in hospitalizations. For now, deaths continue to hold steady at only a few deaths per day. We'll take the next slide. The rises in cases and hospitalizations that we're seeing are not distributed equally among our residents. On this slide, you can see the age-adjusted case, hospitalization, and death rates amongst all racial and ethnic groups over 2-week periods, first that ended May 22nd and the second that ended June 19th of this year. This analysis does not include the most recent data, which I just showed you, which has the sharp increases in cases this past week, and will include the more recent data in next week's analysis. When we look at the rate of new cases, we can see that over the month preceding June 19th, we experienced small decreases in the rate of new cases among Latinx, white, and Asian residents. However, over the same period, we saw an increase in the rate of new cases among Black residents from 39 cases per 100,000 people to 46 cases per 100,000 people. And we see a similar pattern when we look at hospitalization rates over the same month-long period. During this time period, hospitalization rates decreased by between 10 and 30% among Latinx, white, and Asian residents. But over the same period, they increased by about 10% among Black residents, from 8.4 to 9.3 hospitalizations per 100,000 people. Death rates have not followed the same pattern, and they've decreased by substantial proportion across all racial and ethnic groups. It is true that past increases in hospitalizations have always led a few weeks later to a proportionate increase in deaths. However, we're hopeful that given the very high vaccination rates amongst older residents and many of those who have underlying health conditions, we're hopeful that the increases in cases and hospitalizations that we're experiencing do not result in a corresponding rise in deaths. Nonetheless, these disproportionately increasing rates of cases and hospitalizations among Black residents are a cause for alarm, and they require strategic actions to prevent increased transmission and illness. We'll take the next slide. We've also seen slight increases among children beginning in June of this year and affecting all age groups. Between May 23rd and June 23rd, the daily average of reported cases increased from 5 to 8 in children 0 to 4, from 13 to 14 in children ages 5 to 11, and from 14 to 16 in children aged 12 to 17. We haven't seen a simultaneous increase in MIS-C cases, but we'll watch for this closely since MIS-C cases usually lag after increases in COVID cases among children. We'll take the next slide. With the recent rise in cases, tracking the proliferation of variants of concern remains a priority as we seek to better understand the factors that may be contributing to increased community transmission. And I want to note that the yellow bar at the very end is incorrect. So we'll get a new slide out to all of you later today, but I'm going to talk the correct data and we're going to ignore the last bar on this slide here. We have been watching particularly closely for Delta variants, which were first detected in India and are now estimated to comprise more than 26% of US cases. We're especially concerned about this variant because it appears to be highly transmissible. That is, it's more contagious even than other highly contagious COVID variants. And because there is concern that it may cause more severe infections than other COVID variants, we're watching it carefully. While emerging data affirms that fully vaccinated people are well protected from severe infections with Delta variants, people with only one vaccine are not as well protected. And there's increasing evidence that a very small number of fully vaccinated individuals can become infected with the Delta variant and may be able to infect others. This slide shows variants that were identified by both our public health lab and a group of other California laboratories from about 7,078 specimens that are linked with LA County residents. The yellow bars do represent the Delta variants, and as you can see a little bit here, we started seeing increases in the Delta variant in early April and continue to see those increases now. We can go to the next slide. This trend line does show the trajectory of the Delta variant among the specimens that were sequenced by several labs serving Southern California, including the LA County's Public Health Lab. Between last week and this week, the number of sequences with Delta variants isolated doubled, and it now reaches a total of 245. And this is about 44% of all sequences reported. Some of these newly identified Delta cases occurred weeks ago, which is why you don't see the bars doubling in size. Because the decisions on which specimens to sequence are often driven by the management of outbreaks, or they're part of an effort to understand vaccine breakthrough cases, we can't really generalize from this data to the broader population. However, the rising proportion of Delta among sequence variants of concern is consistent with what other parts of the US are seeing, and for certain represents increased circulation of the variant. Given that 4 million residents in LA County are not yet vaccinated, the risk of increased spread is very real. We'll take the next slide. Vaccines do remain the most important tool and a very powerful tool that we can use to keep COVID transmission and the incubation of variants low. Although vaccination administration has slowed, we're still making some progress, as you can see on this slide. As of June 27th, we've administered more than 10.4 million doses of the vaccine in the county, including more than 5.8 million first doses and more than 4.6 million second doses. This means nearly 5.7 million LA County residents have received one dose, and nearly 5 million are fully vaccinated. Amongst LA County residents 16 and over, 68% have received that first dose of the vaccine, and 59% are now fully vaccinated. And among our seniors 65 and over, 87% have received one dose of the vaccine and 76% are fully vaccinated. I'll take the next slide. While we're grateful to everyone who's done their part by getting vaccinated, we do continue to see fewer folks than we'd like getting their first doses of the vaccine week to week. As you can see from the vaccination trends represented on the slide, between June 21st and June 27th, we administered about 700,000 doses across the entire county network. This number is likely to increase because of the lag in reporting, but it's unlikely to reach the 100,000 doses we're hoping to administer each week. And this will be the second week in a row that we're going to be slightly under. With cases now on the rise again, we would really like to see these numbers go up. Next slide. Although we're concerned that the overall vaccination numbers are lower than we'd like them to be, I do want to note that there's continued increases in vaccinations in our younger age groups. As of June 27th, 37% of our 12 to 15-year-olds have received at least one vaccine, as have more than half of our 16 to 17-year-olds. We've seen much smaller increases among 18 to 29-year-olds, whose proportion for vaccinations increased from 51 to 56% between the end of May and the end of June. And among our 30 to 49-year-olds, they also saw a smaller increase from 61 to 65%. Next slide. You do see a similar trend among age groups who are fully vaccinated, with the highest rates of relative increase among the groups that have most recently become eligible for the vaccine. We'll take the next slide. At the same time that we're seeing rises in cases and hospitalizations disproportionately affecting people of different races and ethnicities, we're also seeing gaps between these groups when it comes to vaccinations. For individuals 16 and over, only 44% of Black residents and 54% of Latinx residents have received at least one dose of the vaccine. And we continue to see relatively small increases in vaccination of around 7% in these groups. If we look at American Indians, they're at 61%, 65% of folks are vaccinated amongst white residents, and 75% of Asian residents are vaccinated, with slightly smaller relative increases for each of those groups. We'll take the next slide. Among adults 65 plus, we're making more headway, as we've noted before, on closing these gaps. And this reflects in part the longer period of time they've had to get vaccinated. The proportion of Black seniors with one dose of vaccine went up to 66%. 67% of American Indian and Alaska Native seniors are vaccinated with one dose, and more than 70% of Latinx, white, and Asian seniors now have one dose of the vaccine. We'll go to the next slide. We do continue to look at age subgroups by race and ethnicity, as we have on this slide. And unfortunately, we see the same troubling gaps among teens and younger adults that we've been reporting this past month. Among both the 12 to 15 and the 16 to 17 age groups, only about a third to one half as many Black and Latinx teens are getting vaccinated when compared to teens that are American Indian, Alaska Natives, whites, and Asian. The data also shows a significant gap among young adults 18 to 29-year-olds. 28% of Black adults in this category and 42% of Latinx adults have been vaccinated. And you can see that that compares with 75% of Asian adults and 58% of white adults. The disproportionality persists again between among 30 to 49-year-olds. In this group, a little more than half as many Black adults have been vaccinated as their Asian and white counterparts. And as I've noted before, among our essential workers or potential workers between the ages of 18 and 49, among our Black, African American, and Latinx residents, we have less than 50% have received one dose of the vaccine, or just at 50% now for Latinx residents. But we have a lot of people in those age groups that are still not vaccinated. And as I just noted, many of these young and middle-aged adults are part of our workforce, and they're members of our communities where we're starting to see a rise in cases. With the Delta variant increasing and our reopening in full swing, it's really important that we focus on building vaccine confidence and take sensible public health actions that provide protections to those still unvaccinated, particularly those that are making up our essential workforce. Next slide. The best way, obviously, to protect essential workers is to close these vaccination gaps. And as you can see on this slide, this is not, unfortunately, happening. Our counties here, you can see the county's case, hospitalization, and death rates side by side with each group's vaccination rates. The trends are very concerning given the proliferation of the Delta variant. Cases, hospitalizations, and deaths are highest among Black and Latinx residents, while vaccination rates in these groups remain the lowest. This does mean that people have the lowest levels of protection from this virus in the communities where transmission is already highest. And in some cases, as I noted earlier, transmission is on the rise. If a viral variant causes a big surge of infections, those not yet vaccinated will remain the most vulnerable. We'll see the next slide. To close the gaps, the work remains similar to what we've been doing for the last few months, making it as easy as possible for eligible LA County residents to get vaccinated. You can see on this map this week, we have 767 sites that are offering vaccinations. This includes our pharmacies, clinics, community sites, and hospitals. Many of our vaccination sites are concentrated in the areas that have been hard hit by the pandemic. And almost all our sites now offer an opportunity to get vaccinated without an appointment. Many are actually also open weekends and on evening hours. You can still check at vaccinatelacounty.com to find a site near you. I'll take the next slide. Primary strategy continues to be for improving access to vaccines through the deployment of additional mobile vaccination teams. These are teams that take vaccines into neighborhoods so that they're able to reach people who may have limited ability or time to get to one of our established 767 vaccination sites. The blue markers here indicate the 253 sites where our mobile teams are offering vaccinations this week. They work with employers and community organizations to provide vaccines at convenient locations where residents can gather. And as we've noted before, we do have a form on the website so that anyone can request a mobile team. And we do encourage employers and event organizers to let us know when they want to host a team. We can take the next slide. I'm excited to announce that this week we're unveiling our new recovery metrics dashboard on the website. The address is here at the bottom of the screen, publichealth.lacounty.gov/media/reopening-dashboard.htm. As I shared last week, this dashboard will contain weekly updates on the metrics that we watch to better understand the pandemic's dynamics and to help guide our allocation of resources. This should be live at this very moment if you go to this link. And from today onward, you should be able to view it at this address, which will also be linked to our main website. We'll take the next slide. We're already presenting on a weekly basis much of the data that will be included in the recovery dashboard. And every week, we'll try to highlight select updated information from the dashboard. This week, I want to update you on COVID cases among fully vaccinated people in LA County. These are often called breakthrough cases. We do keep a close eye on the number of people who test positive for COVID after being fully vaccinated, along with those who are hospitalized and those who tragically pass away. This graphic presents these numbers in LA County, but I want you to note that the circles are not to scale. We look at the positive tests in the group of more than 4.5 million LA County residents who achieved full vaccination status from the time we began vaccinating in December through June 29th. Among these fully vaccinated 4.5 million people, we've identified 2,190 people who tested positive for a COVID infection contracted more than 2 weeks after they were fully vaccinated. This means that about 0.05% of all vaccinated people tested positive for COVID. Very, very small number. 192 people, or 0.004% of those fully vaccinated, were hospitalized for COVID infections that they contracted while they were fully vaccinated. And 20 people died of their infections who were fully vaccinated. This is 0.0004%. These numbers are very similar to the numbers we saw when we last looked at post-vaccination infections earlier in the month, with tiny increases in both case rates, where we went from 0.04% to 0.05% for cases, and for hospitalization rates, where we went from 0.003% to 0.004%. So we'll be watching these closely in the weeks and months to come, but there's ample evidence that the vaccines remain extraordinarily powerful at preventing people from becoming infected, more powerful than that even on preventing people from becoming seriously ill. And fortunately, they provide a lot of protection against dying from COVID-19. We'll take the next slide. I'm sure many of you are already aware that on Monday, we recommended that LA County residents wear face coverings while indoors, regardless of vaccination status, in those settings where vaccination status cannot be verified. I wanted to take a little bit of time to explain our reasoning for this recommendation. As we've just described, we are seeing increased circulation of the more infectious Delta variant that we're still learning about. The illness it causes in unvaccinated people may be more severe than the illness caused by other variants. And while vaccines protect fully vaccinated people from serious illness and death caused by the Delta variant, it does seem that this variant spreads very easily and causes mild illness in a very, very small number of vaccinated people. Critically to us, it's still unclear whether the very small number of people vaccinated with the vaccines available in the United States can transmit Delta variant infection. The concern about the variant is made more real by the fact that in the 2 weeks since reopening, we've seen our case numbers and our test positivity more than double. And these increases are once more disproportionately affecting communities of color, where many of our essential workers live. Given that we have large numbers of unvaccinated people in Los Angeles County, 4 million in total, including 1.3 million children not yet eligible to be vaccinated, another wave could become a very real possibility. While we still have some uncertainty about what the Delta variant means in our current context, the experiences of other countries that are contending with high numbers of this variant are concerning. In Israel, although over 60% of the population is fully vaccinated, they are experiencing a surge of Delta variant infections that include a significant number of fully vaccinated individuals. And in India, healthcare workers fully vaccinated with the AstraZeneca vaccine, a highly effective vaccine, but it's not yet used in the United States, showed evidence of transmitting the Delta variant to others. Both the WHO and the Israeli government recommend that until more is known about the variant, individuals should add a layer of protection by wearing face masks. At the very beginning of the pandemic, we found ourselves in a situation where we knew very little about the virus, and we had very few tools to combat it. Although we now have 3 vaccines that we know are extraordinarily effective at preventing serious illness and death against the various strains of COVID and variants of concern, there is still much we don't know about this Delta variant, including whether fully vaccinated people are capable of passing along the variant if they become infected. Our recommendation to wear masks indoors will help press pause on viral transmission while we learn more. We have enough risk and enough unvaccinated people for Delta to pose a threat to our recovery, and masking up now could help prevent a resurgence in transmission. So for all of you who made it possible for us to reopen by getting vaccinated, we're asking you to please help us protect our communities by wearing a mask when you're indoors in settings where everyone's vaccination status is not verified. And for those not yet vaccinated, please be sure to always wear a well-fitting mask when you are in any indoor public spaces or workplaces. And while vaccines are not 100% effective at preventing infections, which is why we're asking folks to mask indoors, they do provide the most powerful protection against the serious consequences of COVID-19. So if you're eligible to get vaccinated and you've not yet been vaccinated, now would be a great time to take that step. We all benefit if we get back to very low rates of transmission. We'll take the next slide. Since vaccination continues to be the best protection against all variants of COVID, including the Delta variant, we want to extend thank you gifts to residents who come in to get vaccinated. I want to express my gratitude to the many partners who work so hard to improve vaccination coverage in our county. We appreciate the support of our sports teams, event venues, and local attractions in helping to encourage those not yet protected to get informed and get vaccinated. Beginning this Friday through next Thursday at county-run vaccination sites, LA City sites, and St. John's Well Child and Family Center sites, everyone 18 and older coming to get a vaccine will have an opportunity to win one of 4 packages of tickets and passes to botanical gardens in the area. Each prize package consists of 1 annual membership to the Huntington Botanical Gardens and 1-day passes to Descanso Gardens, the LA County Arboretum, and South Coast Botanic Garden. We greatly appreciate the generosity of our partners at all of these fabulous attractions. With their support, 4 lucky people will get to enjoy both protection by vaccination and some time outdoors in these absolutely stunning gardens. You can see the official rules on the county website for details, and over the next week, we ask you to please make time to get your vaccine. I'll take the next slide. In closing, just as a reminder, with 4th of July holiday celebrations happening this weekend, the best way to stay safe this holiday is absolutely to be vaccinated. If you or any friends or family at celebratory gatherings are unvaccinated or immune compromised, stay outside as much as possible and always wear masks when indoors except when eating and drinking. Please note that home fireworks of any kind are not legal in LA County because they're dangerous both to people and to our highly fire-prone environment. If you'd like to enjoy a light show this holiday, please do the right thing for your loved ones and your neighbors and enjoy one of the many official displays taking place around the county. Happy 4th of July, and thank you. I'll now take your questions.
Great. And if you have a question, you can click on the hand icon, which is listed in the participant panel, and that'll put you into queue. And as a reminder, we will be doing remarks in Spanish at the conclusion of the Q&A session at around 3 o'clock. First, we'll go to Claudia Pescu with KNX.
Hi, I have a couple of questions. Excuse me. So you said it's unclear whether fully vaccinated people can transmit the Delta variant, and I'm wondering if contact tracing is providing any clues on that at all. And then given the ongoing vaccination gaps that you mentioned and concern about essential workers, do you think that vaccinations should be mandated for city and county employees once the vaccines get full authorization? Thank you.
Oh, yeah, thanks, Claudia. We're using both. I mean, we're trying to look through contact tracing, particularly in sort of closed environments, to figure out if we can identify the exposures. Because, what we really need to do is find out whether a fully vaccinated person that ended up testing positive is linked to another case amongst either another fully vaccinated person or more likely with a person who's unvaccinated. It's really, really hard to do because of the long incubation period, but we're working on it in some of our more closed environments to see what information we can find, and we'll obviously share that with you. I will say that there are researchers and scientists that are also looking at this, and we appreciate all their help trying to tease this out. The data that I talked about from India is some of the most conclusive evidence we've seen, but it was a different vaccine, so we need to get more conclusive evidence about transmission amongst people who are vaccinated with the 3 vaccines that are being offered and are approved under emergency use authorization here in the United States. In terms of, our recommendation on mandating vaccinations, I mean, we're obviously at this moment, super focused on building confidence and trust in these vaccines, since they are at the moment just under emergency use authorization. And I think that's the appropriate set of activities for us to engage in. We are noticing, obviously, that there are some other counties that are moving to let folks know that they're going to be mandating the vaccines. We also know there are some businesses and certainly some healthcare systems already moving in that direction. We'll be working very closely, obviously, with the Board of Supervisors and with our partners to determine what makes most sense for the county. I do know that right now, the most important steps we can take is to just improve confidence in these vaccines, have those conversations, answer people's questions, make sure they have access to accurate information, and have our patients, available to let people know that we understand these are difficult decisions for some folks, and that we're here to help them get their questions answered and to move forward, hopefully with a decision to get vaccinated, especially now that the risk has increased. But I'll go on to the next question.
Great, and that'll come from the line of Patrick Tilley with NBC News.
Hello, doctor. Forgive me. I must confess I got lost in the chronology of the case increase during June and what happened after June 19. Is the increase in cases, new cases, still entirely within the African American community, or are we seeing increases in other demographic groups as well? And second question, a mass question, do you have any specific metric in mind when the county would be able to relent on the indoor vaccinated mask recommendation? Thank you.
Great questions. Thanks so much, Patrick. One of the issues with providing those daily numbers and then doing the trend lines is we often go back and try to assign an episode date to all the test results. And that means we have a little bit of a lag. So I can't tell you definitively exactly where we're seeing the increases. We had a little bit of evidence that it is still concentrated more in the Latinx and the African American Black community, but we also think there might have been a slight uptick as well amongst our white residents. So you'll need to wait with me until next week when we've got the episode dates and we can extend out the trend line to account for this past week's increase. I mean, this is where we've seen the most significant increase across the county. So I would imagine it's going to get spread a little bit differently, but won't be able to tell you that until next week. And in terms of, is there a metric that we look at to think, to have more confidence that vaccinated people don't need to go ahead with our request that they mask up when indoors? Absolutely, we're waiting to get a lot more information about the Delta variant. And I think as we get more information about the Delta variant, we'll feel more confident about giving out the right set of recommendations if they're going to change. Right now, this is a precautionary recommendation, given that we don't have all the information we wish we had, but we know we've got some tools at hand that absolutely help us slow down transmission. So it seems prudent to use those tools while we're trying to get more information about the Delta variant. And that's especially true since we've seen a significant increase in cases this past week. We'll feel a lot more secure about recommendations moving forward once we have a better understanding of the Delta variant. And as soon as we do, we'll revisit obviously our recommendations. And I want to stress again, these are recommendations based on the team here looking at all of our data and noting, as we did earlier, before we even started to see this big an increase, that there's more risk here because of the Delta variant. We'll go ahead and take the next question.
That'll come from Ron Lynn with Los Angeles Times.
Hey, Dr. Ferrer, thanks for taking our questions. Number one, previously I understood the consensus was that people who are fully vaccinated are not very likely to either develop illness or be contagious. Your own data on breakthrough infections seem to provide reassurance about the safety vaccinated people can feel. But now you're mentioning that there's increasing evidence that a very small number of fully vaccinated people can become infected with the Delta variant and may be able to infect others. This sounds new and significant and very different from what the CDC and Dr. Fauci said today. Can you elaborate more about your shift in thinking and how concerned vaccinated people should be about the risk of becoming sick and becoming contagious with the Delta variant? Number two, for both vaccinated and unvaccinated people, how concerned should we be that cases and hospitalizations are rising again in LA County? And how does that square with the fact that cases and hospitalizations overall remain extraordinarily low? And then two more things. There was a recommendation an op-ed in the Washington Post by a Johns Hopkins professor kind of slamming your recommendations, saying that your recommendations on masking is having a bad effect of basically telling people the vaccines won't allow you to have a normal life, so why bother? And the county has now scared off business travelers and conference organizers. Can you respond to that? And then finally, is your recommendation about protecting vaccinated people or just about modeling good behavior to unvaccinated people? Thank you.
Oh, those are a lot of questions. Hopefully I'll remember them all. Let me just start with, what do we know about the Delta variant? And again, we all have access to the same information. So I think it's absolutely true that the vaccines we have in this country, our 3 vaccines, provide powerful protection against serious illness and death from all of our variants and the commonly circulating virus. And our numbers show that and consistently show that. I think there's 2 things that may be different about the Delta variant. One is it's more infectious than any other variant we've seen, which means that it's likely that one person can infect more people, and that those people that can get infected can infect more people as well. So you could see a much more rapid spread where the very small number of fully vaccinated people could still be responsible for increasing some of the spread, even if it's a very small number. And I want to say, like, for us, because we're such a big county, very what we consider very small numbers are still, as I noted today, a few thousand people. So we have over 2,000 people fully vaccinated that in fact tested positive. So, again, we just have to be mindful that the percents are very small, but the numbers of people are still, for us in our county, they still present somewhat of a risk if they're able to infect others. And I think that's the big question about the Delta variant, is we've got a lot of evidence that even if you're fully vaccinated, you have very little risk of becoming seriously ill. I showed the numbers today, and even a tinier risk. It's 99.8% of the people who are passing away from COVID are people who are not vaccinated. So you have such a tiny risk yourself. But the big unknown is, can you become infected, have mild illness, and go ahead and spread that infection to others? And we are looking for the answer to that question. And that will help, obviously, make all of us feel a lot better about, if we're fully vaccinated, being unmasked in places where there may be lots of unvaccinated people also unmasked, which is the situation that we see all around us right now. Lots of different places indoors where lots of people, both vaccinated people and unvaccinated people, aren't protecting themselves and protecting others. So I think the call to wear that mask is an acknowledgement that the Delta variant is different from the other variants we've seen, and in places that have, that have been able to provide fairly good evidence, it looks like fully vaccinated people may in fact be getting infected with the Delta variant at a higher rate than we've seen with other variants. So we should pay attention to that. And we should be cautious, particularly in a county like LA. the concerns about, rising cases and the rising test positivity rate is always a concern and should be a concern for all of us. We'd like to keep transmission as low as possible. Huge advantages, keeps many more people well, but it also gives less opportunity for there to be more mutations of COVID-19 that could lead to other increasingly dangerous variants. So we all want to keep transmission low for the most common sense reasons. So whenever you see a doubling of cases over a very short time, we all need to pay attention to that. And we all need to think about what else we could be doing that may help us get back to reducing the spread. The most important thing is to get more people vaccinated. That's the reason why our rates dropped, and that's the reason why we'd be able to maintain very low rates of transmission. But given the reality that there are 4 million people right now not vaccinated in LA County, I think using some common sense public health measures is equally important. So continuing to wear those masks, particularly for unvaccinated people, particularly indoors, seems like a sensible step for us to take. And frankly, I would probably take some issues with the characterization by the Washington Post article that, this is going to have a detrimental effect, on business, et cetera. I mean, I want to know two things. One is it's a recommendation, it's not a mandate. And two, asking people to wear a face covering does not interfere at all with customary business practices. We haven't told people to stop eating or drinking at restaurants or bars or gatherings. What we've said is pretty sensible. When you go into a place, you don't know everyone's vaccination status, you're indoors, it's, just put on that face covering to maximize protection for yourself and for everyone else there. And that means it translates to everyone in our communities. And then I wasn't sure about the last question about sort of, is this more about modeling or is this about something else? I mean, I think for us, this is all about protecting people. You have a lot of unvaccinated people here, 1.3 million of them who cannot get vaccinated. Let's just keep doing the best we can to protect each other and to keep transmission low. And, if mask wearing indoors provides that extra layer of protection, I think it's worth it while we get more questions answered about the variant and we get more people vaccinated. Thanks for that. Hope I got to most of them, Ron.
Next, we'll go to Denise Tador with ABC7.
Hi, Dr. Ferrer. Good afternoon. I had a question about the Delta variant. We've heard over and over how contagious it is, and we've heard that it could cause more severe disease, but do we have any current evidence that shows it can be more lethal? And also one more question about the J&J vaccine. A lot of people I've heard who've got it are trying to get an mRNA dose as well. What do you say about that?
Oh, well, let's start with the J&J, vaccine. I mean, that vaccine is equally powerful and equally protective. And if you got your one dose, you're good. It provides a lot of protection against COVID-19 in a similar way, really super protection against hospitalizations and deaths. And it looks like it's holding its own as well against our variants. So I think the evidence is pretty clear that vaccine works, it works well, and you can be reassured that all of the information we have right now indicates there's no need for you to start with a different vaccine to sort of add protection. I think those of you who got vaccinated, you got a lot of protection, and there's lots of evidence around that. In terms of, do we have evidence about increasing illness or severity of illness associated with the Delta variant? There is a study out of the UK that does in fact show increased severity of illness. So obviously watching that information carefully, as well as starting to track, here in LA County and across the country, what we're seeing in the United States. But there is a fairly rigorous study that's already been published that does demonstrate this increased severity of illness associated with the Delta variant. So thanks for that. And we can take the next question.
Okay, and this will probably have to be our last today, so we'll go to Hal Eisner with Fox LA.
Thank you. Dr. Ferrer, thank you very much for the time here. First of all, and I have a couple of questions as well, but I'm a little confused on the circle graph where you show the 20 deaths and those breakthrough cases. Are those all Delta variant cases, or do you even know? And then that Washington Post article aside, there are people out there that are frustrated, they're confused. We only reopened a couple of weeks ago, and all of a sudden they're hearing about wearing masks in the office. And some people are just confused and frustrated. And what do you say to those people? I mean, I understand it's all for the good of all of us, but I'm sure you probably hear some of that as well.
Yeah, thanks so much. Let me just clarify on the breakthrough cases. Those are not necessarily the Delta variant only accounting for those breakthrough cases. Last week, I showed information about the fact that with the Delta variant last week, we haven't, it takes a while we have to interview people to get all this information. But I showed last week that of the 123 Delta variant cases, only 10 of them occurred among people who were fully vaccinated. So that's the data we have about the Delta variant and being fully vaccinated. That was about 8% of those cases occurred amongst fully vaccinated folks. So that's why I'm saying there's very conclusive evidence that people who are fully vaccinated can in fact become infected with the Delta variant or infected with the virus. It's just a tiny number, which is what you saw today, just how small that percent is, whether it's the Delta variant or anything else. But yes, there are breakthrough cases with the Delta variant, as well as with other variants that we see, including the Alpha variant, the Beta variant, UK variant, the South Africa variant, the Brazilian variant. So we do have breakthrough cases across the board, and they're all, relatively small percentages of what we're sequencing. So I think that remains the good news. There are breakthrough cases, and some of them are associated with variants for people who are fully vaccinated, but the number remains relatively small. In terms of the second question, about, the confusion and, why can't we make up our minds? And, I think we learned a lot over the past 18 months about what it means to have a pandemic with a new virus. And I think the hardest thing for everyone has been that you never seem to be able to settle on having all the information you need at the moment to be as consistent as we would like. I would love it if we messaged something last week and that message can remain consistent for the next 6 months. But unfortunately, like the virus changes, it mutates, we get new variants. In this case, we got a variant of concern that seems to be much more infectious than anything else we've seen. So it means that we are going to have to continue to be flexible. I think it's our responsibility to share that information and then make recommendations. I mean, obviously, although community transmission is going up, it's still relatively low. And so this is the time to say, you know what, here's a recommendation. Here's like a best practice that's going to help us, keep transmission low. So, folks can use that information to make their own decisions. But I think it's our responsibility to make sure we're sharing that information to folks. And again, we've been, for 18 months saying we're sorry that this information keeps changing. But the science, it's good that, we are able to share the information as it comes in so that everyone is working on a level playing field, having the same information we have about how it is that we're going to continue on our recovery journey. So thanks for that. And I want to again express my appreciation for all of you and all the work you're doing. And feel free, if we didn't get to your questions, to just send them in and our communications team will get back to you. So thanks a lot.
Great, and thank you all for joining us today. If you do have a question that we didn't get to, you can send an email to media@ph.lacounty.gov. And we wish you all a very happy 4th of July. And we will be doing our Spanish remarks at 3 o'clock, so in about 7.